Good morning. My name is James Ginda, and I'm honored to have this opportunity to be here today to testify before you on this important topic. It is an opportunity for me to advocate for those who do not have a voice, but who are affected by air quality issues. The topic of air pollution and children's health is one that means a great deal to me. I'm a registered respiratory therapist, a certified asthma educator, and a certified health education specialist, and I've been in the field for 33 years. I've seen firsthand the impact of lung disease on the lives of patients I have cared for in hospital settings and in home care. While educating children through the years about lifestyle choices such as cigarette smoking, I've come to realize the effects of environment on their lung health and felt the need to try to make a difference on a more macro level, upstream in health promotion. Environment is something that is too often beyond their individual control, whether it be secondhand smoke, housing conditions, or outdoor air quality, which I will focus on today. Beyond counseling them to remain indoors on the worst air quality days, they are susceptible to environmental triggers when outdoor air pollution makes its way indoors, and particularly for those in urban communities where air conditioning is not an option, and their vulnerability is compounded by other comorbid conditions and socioeconomic factors. Airborne toxins are problematic because of the gaseous components, acid aerosols, byproducts of photochemical reactions such as ground-level ozone, and the effects of inhaled particulate matter deposited within the lungs. Particulate matter is composed of black carbon soot, metals, volatile organic compounds, and crustal materials from mobile and stationary sources, such as diesel engines and power plants. The lungs act as a highly efficient filter structures. Black carbon fine particulates get past upper airway lung defenses, even in healthy individuals, and carry toxins deep into the lungs, including carcinogens. The black carbon and particulate matter has been shown to be a formidable opponent for alveolar macrophages, which are important for infection protection and a last line of lung defense. Chronic inflammation, which is uncontrolled, can lead to airway remodeling and a fixed degree of airflow obstruction, as we see in chronic lung disease. Both the fine particle and gaseous components of air pollution are triggers in asthma and can affect children even at low levels, below the national ambient air quality standards. Weather events such as air temperature inversions can trap pollutants and compound this problem. Gaseous components such as sulfur and nitrogen oxides and acid aerosols are irritating to airways and can induce an inflammatory response in the lungs and constriction of bronchial smooth muscle, which narrows the airways and makes breathing difficult. Asthma is the most common chronic disease of childhood and is responsible for a large amount of healthcare expenditures and lost school days. The burden extends to families who lose work days caring for sick children and to the healthcare system with increased acute care visits, emergency department visits, and hospitalizations. Crisis-centered medical care and asthma education are not enough to preserve or improve the health of asthmatic children when environmental triggers are out of the control of the most vulnerable. Indeed, the Healthy People Goals for Improving the Health of Our Nation recognize this in their comprehensive respiratory disease and environmental objectives. In 2010, after 3 years of careful study and consideration, the Rhode Island General Assembly passed a comprehensive clean construction bill as part of the Diesel Emissions Reduction Act. Known as an act concerning government responsibility to protect public health from diesel pollution, it is a shining example of a cooperative effort between concerned legislators, state agencies, environmental groups, industry representatives, and health advocates. Local action has also been taken by city councils to reduce diesel emissions in the form of enforcement of anti-idling ordinances and pollution control devices on their city fleets. This cooperation momentum to address controllable sources of pollution must continue nationwide to improve the health of our communities. Air pollution is not confined within local or state borders, and children upwind can be affected by pollution from distant sources. So we also rely heavily on the United States Environmental Protection Agency and Federal Clean Air Act to protect our children. Children, and particularly children with asthma, are considered more vulnerable to air pollution with their higher respiratory rates, minute ventilation, and outdoor activity and play. Prevention has to be a focus in healthcare, and reducing the health burden of these toxins is within our grasp. On my own behalf, as well as on behalf of the patients and families for whom I advocate today, who I've had the honor and privilege of caring for through the years, I applaud you for holding this hearing and urge your support of regulations and legislation aimed at continuing to reduce this preventable health threat. Children are the future of our nation, healthy children in safe and healthy communities. The yellow caution signs for children playing can serve as a reminder of all childhood health threats. Creating a healthier environment by controlling air toxins from mobile and stationary sources will benefit not only those most at risk, but indeed all of us who depend on breathing clean air for optimal health. Thank you.